Do you know exactly what to do in the first 30 seconds if somebody collapses in front of you? Imagine you're at an airport, it's early morning because you wanted to save that $20. Now you look around and everybody looks tired. One man in particular draws your attention. He doesn't look too well. He looks sweaty. He's clenching his chest, and the next second he just drops on the floor. He's unconscious. People freeze. You rush to the man. You scream for help. Is anybody here a doctor? Nobody answers. Is anybody here a nurse? There's complete silence. It takes a couple of minutes for the airport police to arrive. He starts performing CPR because he didn't have a pulse. Then the EMS arrives, takes him to the hospital. Unfortunately, later that day, he dies. Now, was there something that could have been done to give him a better chance at life? Here's a part that's very hard to digest. Every year in the US, about 350,000 people suffer from cardiac arrest outside a hospital setting, meaning at home, at work, or in a public place. And only 40% of them are fortunate enough to receive CPR by a bystander. The rest 60%, they'll have to wait for the EMS to arrive. And that's not because people don't care or they don't know CPR. That's because they're afraid of doing it wrong, afraid of hurting someone, afraid of getting in trouble. And the truth is, you cannot expect a doctor or nurse to magically appear whenever somebody has a cardiac arrest. That means the first responder is usually just a regular person, like you. What most people don't realize is this: Good Samaritan laws exist, and it protects people who are trying to help. And in cardiac arrest, doing something, even imperfectly, is always better than doing nothing. So the real danger is hesitation. When someone collapses, the clock starts ticking. The ambulance is going to take several minutes to arrive, but the brain cannot wait that long. The brain only has a couple of minutes before it sustains permanent brain damage. And in that gap, before help arrives, you might be the only difference between life and death. In countries like South Korea and Singapore, the bystander CPR rates are much higher, at more than 60%. If the US could reach those same numbers, we could save an additional 25 to 30,000 more lives every single year, equivalent to a stadium full of people watching a football game. And we could do that without new medications, without new hospitals, or without new advanced technology. Just people knowing what to do and having the courage to act. Isn't that something to think about? Don't let hesitation be the reason a life ends. So let me ask you two very important questions. You can pause the video and think about it if you want. The first question: do you know exactly what to do in the first 30 seconds if somebody collapses in front of you? The second question: what's the actual difference between a heart attack, heart failure, and cardiac arrest? I'll give you a hint. They're not the same thing. You can think about it, and we'll get back to this at the end of this video. And if you're not sure, you're not alone. TV and news get this wrong all the time, and I believe that might be one of the main reasons for people's misconception. But I guarantee that you'll be able to sing these answers by the end of this video. And this isn't a trivia or a pop quiz. Knowing this changes what you do, how fast you act, and if somebody will live or die. So let's clear it up. We'll break this down one by one, and we'll have a complete picture at the end. Think of the heart in 3 P's: plumbing, pumping, and power. Let's start with the plumbing problem: heart attack. Or if you want to sound fancy at a dinner, you can call it myocardial infarction. Myocardium just means the heart muscle, and infarction means tissue damage from loss of blood supply. So basically, as the name suggests, heart attack is the damage to the heart muscle due to a blocked blood vessel. The classic symptoms include chest pain or pressure, shortness of breath, nausea, and sweating. And the treatment? This is a medical emergency, so you need to get to the hospital immediately. The doctors are going to treat you with blood thinners like aspirin or clot busters like TPA, and a procedure called as angioplasty, in which they insert a catheter into your artery and unclog the blood vessel using a balloon and place a stent. And remember one important thing: the heart is still beating in a patient with heart attack, and they do not need CPR. So heart attack is basically a clogged pipe and one way or the other, the pipe needs to be unclogged. Now let's get to the pumping problem, the heart failure. Honestly, it's a terrible name. The heart hasn't failed in anything. It's still pumping, it's just very lousy at what it does. It's mostly due to a weak pump, sometimes due to a stiff pump. The classic symptoms are shortness of breath and leg swelling. It's due to the excess fluid that the heart is not able to handle. Climbing one flight of stairs might feel like they're climbing Mount Everest. Sometimes they'll be sleeping on 5 pillows because sleeping flat on a bed makes them short of breath. Their legs swell up like balloons. This usually happens over a period of months to years, and it's mostly due to uncontrolled high blood pressure, sometimes prior heart attacks, excessive alcohol and drug use, and there are many other causes. So it's a chronic problem and treated with medications. So heart failure is just a tired pump that makes you feel tired. Now, let's get to the final boss, cardiac arrest, or the power problem.
You have the right to remain silent.
The heart runs on electricity, just like a house, and the powerhouse is inside of the heart itself. But when the electrical system shuts down, the heart runs out of power. The heart stops beating. There's no pulse, there's no blood flow, and the patient collapses. Here's something important. Saying someone died of cardiac arrest is just like saying they died. It doesn't give you any new information. So cardiac arrest is never a diagnosis. It's just the end result. Cardiac arrest is just the most common mechanism of death. About 99% of everyone who dies from cardiac arrest. That's right. And 1%, they're brain dead, meaning the heart is still beating while the brain has switched off. To keep it simple, there are only 2 modes of death. Cardiac arrest, that's how most people die, almost everyone. And brain death, that's how 1% of people die. And keep in mind that brain death is still a death, legally and medically. We just don't have any way of resuscitating the brain like we do CPR for a cardiac arrest patient. Basically, anything that's trying to kill you can cause cardiac arrest, even if it's completely unrelated to the heart, like a bad infection, or a heat stroke, or severe blood loss from trauma. And when you hear the phrase sudden cardiac arrest in the news, what they usually mean is something slightly different, called as sudden cardiac death. That means someone went into cardiac arrest shortly after a major event, like a massive heart attack, a blood clot in the lungs, sometimes a blunt trauma to the chest called as commotio cordis that happened in the case of Damar Hamlin, if you remember. Sometimes congenital heart conditions that they didn't even know about. And TV shows and media, they love to confuse this with heart attack. So now let's resolve the story. What to do in the first 30 seconds if somebody collapses in front of you. And regardless of the cause, the treatment, in the initial treatment, remains the same. First of all, don't panic, and it's important. Second, check for responsiveness. See if they're trying to wake up, if they're responding. Third, check for pulse. The best place to check for pulse are the carotid arteries. It's on either side of the windpipe, the right one and the left one. Then you call 911 or ask somebody to call for you. Fifth, start CPR if you don't feel a pulse. Here's something important. Trained responders should perform 30 chest compressions followed by 2 rescue breaths, while untrained responders can do hands-only CPR using chest compressions alone. Push hard and fast at a rate of 110 to 120 compressions per minute, keeping your arms straight and using your body weight by leaning over the patient, because your arms alone are not strong enough for a good CPR. Place the heel of your hand in the center of the chest over the lower half of the breastbone. Lock your fingers together. Do not place your hands over the upper chest, ribs, or the belly. Sometimes a person may still have a pulse but may not be breathing. This is called respiratory arrest and is common in cases like drug overdose, drowning, and seizures. In this case, give rescue breaths at a rate of 1 breath every 5 to 6 seconds and check for a pulse every 2 minutes. If the pulse disappears at any point, begin full CPR immediately. And remember, gasping or irregular breathing is not normal and should be treated as no breathing. You can see in this video Dr. Whitman is performing great CPR with good quality compressions, using his body weight with movement in his hip instead of his arms. So what would you do if you're not sure somebody has a pulse or not? And that's a very practical scenario, because sometimes the pulse is too weak to be felt, especially by a layperson. If unsure, it's always better to start CPR in an unconscious patient, because the risk of not getting CPR when needed is death. But the risk of getting a CPR when it's not needed is fractures and pain, which I'd take over death anytime. Now, let's talk about AEDs, the magic boxes. So AEDs are incredible magic boxes. They tell you exactly what to do. But movies lie about one thing. In the movies, they try to shock a flat line and then the patient all of a sudden wakes up, but that doesn't happen in real life. A flat line doesn't need to be shocked because it's useless. What you do shock is something more chaotic, like a ventricular fibrillation or a ventricular tachycardia. Luckily, you don't have to remember these rhythms or these names. The AED will do that for you. It will tell you when to shock. You just have to press the shock button after you say, "Clear." And remember, do not touch the patient when giving a shock unless you want to get shocked too. You can find AEDs at a lot of public places nowadays, like an airport, gym, or malls. So let's recap one of the questions we left out. What's the actual difference between a heart attack, heart failure, and cardiac arrest? So heart attack is a plumbing problem, heart failure is a pumping problem, and cardiac arrest is the complete power shutdown. Now, let me tell you this. YouTube might be a place to understand when a CPR is needed. But CPR is a hands-on skill. It's always better to learn it from a certified BLS provider near you. Congratulations, you're now smarter than most of the TV doctors. I'm Dr. Karna. Thank you for watching.